As our study showed, it's important to look where the patient is on the illness trajectory. Is it the acute phase where he has a lot of therapy? Is this a maintenance phase where there is a low therapy? This is important, and you have to look on the different types of therapy. So the information needs are different if a patient gets a stem cell transplantation or he gets oral therapy. Other challenges for making decisions about information needs of patients is also to look on the relevance or the carers of the patient. They have informational needs also, which are very important. So we did some interviews before with some carers, and they said they would like to have their own support group where they can discuss their carer issues. So you always should include the carers and the relevance.